Myself, Dr. V.S. Rathore. I am an aesthetic plastic surgeon working in the city of Kolkata for last 18 years. Today I will be telling you about hair transplant, its principle, how it's being done, and basically my talk today is to educate you regarding the consultation of an hair transplantation when a patient comes for hair transplant surgery or he is coming to fix up his thinned out scalp with hair transplant. So first and foremost, I'll tell you hair transplant is a permanent solution of baldness. So the basic principle of hair transplant is that we take out hairs from a zone of scalp which is permanent, because you must have seen any patient who is very aged. You will see there is a band of hair just above the ear and the back of scalp that remains till the last breath of any particular person. Similarly, the body hairs like the beard, chin and the other parts of the body, they also remain till the last breath of any particular person. So there are two reasons for these areas of hairs to remain permanent. First is the genetic reason. Because of their genetic DNA signal, they remain till the last breath of person. And secondly, there are no DHT receptors on these hairs as well as the body hairs. So when the hair roots are taken out from the permanent zone and implanted into the bald area, they will grow normally and they will remain till the last breath of that particular person. With age, they will become grey and they will thin out also, but they will never vanish. So hair transplant surgery is very safe and the results are natural and normal. And as such, there are no side effects of hair transplant provided you have chosen your surgeon rightly. Rightly in the sense you must see your credentials of a surgeon. He should be or she should be able to do both the procedures like FUT and FUE and check his records, how many patients he has done, analyze his patient's results, then go with the surgery with your surgeon. So the entire operation is done under local anesthesia. Local anesthesia means we block the scalp. The patient is fully conscious. He can have tea break, coffee break, lunch break. He can listen to music. And at my clinic, there's a facility to watch movie also during the surgery. And this is a day care surgery, means it's an OPD surgery, means patient will come to the clinic, get his surgery done and go back to home same day. No need of any admissions. In general, it takes around 6 to 8 hours of surgery time. And the fourth important part is a teamwork. I correlate my hair transplant surgery with two things. First is with the musical orchestra. You must have seen musical orchestra in which each and every artist plays his own instrument at the best. Then only the musical orchestra is successful. So I have my hair transplant team orchestra. I am the master of orchestra and there is my team. It is there for me for last 18 years working with me. So there are some operative steps which will be done by me only and there are other common steps which will be done by my team. Second correlation is you must have seen a train. There is an engine and there are bogies. So no matter how many bogies are there on the track, they can't move unless until the engine comes. So when I am doing your surgery, you have come to my clinic, unless and until I start, nobody can start the procedure. So all the steps and the entire surgery is under my care only. So there are two ways of doing hair transplant process. One is an FUT, the other name is a strip method, and the second is FUE. I do both the techniques. FUT stands for follicular unit transplant, and the other method is an FUE, means follicular unit extraction. First, I will be telling you about the FUT process. In FUT, what we do, we take out a strip of skin from the back of scalp, which is the permanent area. Once the strip is removed, that area is stitched up. The stitches are removed in 10 to 12 days time. The stitching is done in a way so that through the scar also the hairs will come out. That makes the scar less visible. This technique is known as trichophytic closure. Trichophytic closure technique, I'll be telling you in some other video in details with pictorial demonstration. Once the strip is removed, it is handed over to my team. They start dissecting the strip under magnification. And as you know, our hairs are in groups. Some are single, some are double, some are triple, some are four also. So after dissecting, suppose this is single rooted hair, double rooted hair, triple, and similarly you get a graft which contains 4 hairs also. Maximum population is of single and double hair roots only. Triple and 4 rooted grafts are less in percentage. So these are known as grafts or follicular units. So simultaneously what will happen in the recipient area, that is the bald area, I will anesthetize that area and I'll inject saline into it, so that to make that area bloated up or tumescent. By bloating up the recipient area, what happens? The blood vessels and the nerves remains deep, there are less bleeding, and then the punctures are made. So what will happen? So these punctures are made with the help of needle. I use an 18 gauge needle. So while making punctures, we have to take care of 3 things in mind: the depth of puncture, the direction of puncture, and the density of puncture. These 3 Ds are very important so as to give the transplant ritual natural. Because our hairs on the scalp, they are in different depth, different directions, means the angle of exit angulation is separate in separate area of the scalp. So these 3 Ds are very important while making the punctures. Once these punctures are made, then the technician which catch hold of this graft and individual these grafts are put into those holes. In 7 to 14 days time, what will happen? The transplanted hair will start growing up and the blood clots and the scabs will fall down. But what happens within 1 to 1.5 month time? All the transplanted hair will shed. This condition is known as shock loss. It happens to everyone irrespective of age and sex of the person. The transplanted roots remains dormant and they will come out from the skin within 3 to 6 months time. At times, some of the follicles may remain dormant for another 2 to 3 months. So, in order to see a result of a hair transplant, one should wait for at least 1 year. Then only they should take decision to increase the density or not. So, as soon as the transplant surgery is over, I advise my patient not to wet the scalp for first 48 hours. I generally put a surgical cap on the scalp transplant area and ask them not to touch and open. After 48 hours, I ask my patients to come to clinic and we show them how to wash them with mild shampoo like a Johnson's baby shampoo. And from second day onwards, the patient will start using the medical treatment. Male patients can take Phenex 1 milligram, hair vitamins, start applying minoxidil and topical finasteride combination and hair serums. They should have healthy diet. They should refrain from tobacco in any form. That means active and passive smoking has to be avoided. Similarly, chewing tobacco has to be avoided. And avoid any direct trauma to the scalp like don't get engaged in close sports activity like football, basketball, kushti, rugby, boxing. High intensity exercise should be avoided for first 5 to 7 days and close sports activity for 1 month. And I recommend not to wear helmet for first 3 months. So these are the precautions. Along with that, I always say to my patient, don't wear a tight neck collar t-shirts which you have to slide down from head to neck, or you have to take it out. Just to as an extra precautions they have to. It's better to wear a shirt with the front open shirts. So these are the general precautions which the patient should take. Other thing which I do and advise to my all patients who are undergoing hair transplant is that to take PRP or a GFC treatment. In my clinic, I practice to do first GFC treatment to all my patients on the day of transplant. It is mainly done in an area where I am not going to transplant. There is a decreased density. I also inject the GFC solution in the area where I am going to put hairs also. And I use the same solution, PRP or GFC solution, as a graft holding media. The details of which I will be telling you in my next videos. What is the advantage of keeping the grafts into the PRP solution. And I recommend post-transplant 3 sessions of a GFC at a monthly interval following the transplant and a 4th session at 6 months. And the medicines, I advise my patient to continue for prolonged duration. There is a dual advantage of continuing medicine for prolonged duration is that initially it is providing support to the transplanted hairs. Secondly, it is prolonging the life of your existing hairs. Now, I'll tell you one important fact about the result of hair transplant, how it is judged. See, hair transplant result at 1 year is the best. First year means 1 year following the transplant, because it is due to your transplanted hairs. There is an improvement of your existing hair. And third is there are some medicine dependent or a treatment dependent hairs also. So there are 3 kinds of hairs. So one which are transplanted, which will have the characteristic of your back hairs. Second, the existing hair will improve. And third, there are small fine hairs which grow due to the medicine and the PRP or GFC treatment, because it is reviving your existing follicles or the hair roots which are already there but which were not growing. So they are the treatment dependent hairs. So here comes the importance of continuing medication for the prolonged duration. If you stop the medical treatment, what will happen? First, the medicine dependent hair or the treatment dependent hair will vanish. Secondly, your existing hair will vanish, and ultimately your transplanted hairs will remain. So here is the importance, and I'll give emphasis of continuing a medical treatment for prolonged duration. Now, little bit of FUE I'll tell you. In FUE, what we do, we shave off the entire donor area of the scalp and the alternate hairs are drilled out. That means we are directly getting to this step, and after that all the steps of the hair transplant surgery remains same. So friends, stay connected with me for any queries related to hair transplant or post hair transplant procedure. You can call at the given numbers, or you can WhatsApp. You can follow me on Instagram. Please subscribe my YouTube channel in the name of Kaayakalp. You can follow me on my Facebook page, LinkedIn and Twitter. Till then, bye-bye.